is a condition that causes concern for all new parents. It's called SIDS, Sudden Infant Death Syndrome. SIDS is the leading cause of death in children between 1 month and 1 year of age. However, most of these deaths happen when babies are between 2 and 4 months of age. As Claudia Solis-Acala explains, while medical professionals may not have an exact cause for SIDS, there are precautions parents can take to try and keep their little ones safe.
Justine Gonzalez is expecting her first child. She's making all the preparations necessary to make her new baby feel safe and welcome. That includes meeting once a week with Susan Cowley, a public health nurse with Tulare County's Nurse Family Partnership Program.
I'm like the youngest, and I never had a lot of siblings, so I didn't really know a lot of how to raise a baby, so I do now with all her education.
Nurse Cowley makes home visits with Justine and other first-time moms to share information about the best ways to care for baby. On this particular day, the lesson was about SIDS, or Sudden Infant Death Syndrome, also known as crib death.
Well, the infant can be found usually in the crib, or it can be found on a couch if the mother leaves the baby on a couch on its stomach. But it's where for unknown causes, specific causes, the baby is found not breathing.
SIDS happens quickly and silently. There are no symptoms. Most babies appear to be healthy prior to death. The exact cause is unknown.
The safest thing is to have the baby laying on a flat surface with just a sheet. I mean, crib sheet over the mattress.
While there are no guaranteed ways to prevent SIDS, there are ways to help your baby sleep safely. Number 1, put her to sleep on her back.
When the baby's placed on the stomach, especially before they have those developmental milestones in strength to push themselves and roll over and kind of get out away from something that might cause the baby to suffocate, that's one particular cause.
Next, you'll want to provide a safe sleeping environment for baby.
There should be no blankets, pillows, toys, a bumper pad that you've seen in the past. Keep the room warm, within, that's comfortable for you is usually comfortable for the baby. Don't have the baby, by windows, the vents, because that can have a rapid change in the baby's temperature. But just using a sleeper is usually sufficient.
Don't smoke. A smoke-free environment is especially important during pregnancy and in your baby's first year of life,
because it puts the infant at a much higher risk for respiratory infections, asthma, which leads to wheezing and difficulty breathing, ear infections, and these are other contributing factors that can cause an infant to have difficulty breathing. And then when the infant is on the stomach and has all these respiratory infections, the airway isn't open up to promote good airway and airway exchange into the lungs.
Consider breastfeeding. Some studies suggest that nursing your child may offer protection against SIDS.
Breastfeeding promotes healthy feeding for one thing. There's good bonding between mother and infant with breastfeeding, and also it helps the baby can get the mother's immunity and have good protection there. And it's just better health and nutrition for the baby, and then less allergies.
Justine says she is now better prepared for baby. She can't wait to welcome her little one.
It's exciting. I'm excited to have a daughter and to be a mom for the first time.
Simple steps can make a big difference for your baby and help new parents rest a lot easier as well.
Thanks, Claudia. To learn more about SIDS prevention and the Nurse Family Partnership Program in Tulare County, call 559-713-5172. That information will also be available on our website. Just go to kvpt.org/0 to 5 and then click on Resources.
This program funded in part by First 5 Fresno County. At First 5, we focus on the first 5 years of life. We fund programs and services that better the lives of children in Fresno County.
Additional funding from First 5 Tulare County, changing lives and building futures. Because it's all about the kids.